Hello, this is Lauren Holley-Allen with Emergency Management Made Easy with Lauren. That's me. I want to start our 2026 series off with somewhat of an introduction. I'm calling it Wisdom You Can Use. And the reason I am doing this, and then I'll give you the backstory, is because we are all lifetime learners. My team, my people who come on here, the old and the new, we never stop learning. We are gaining wisdom. So I'm giving you wisdom you can use. But this isn't mine. I can't own it. I can't coin it. So the backstory is, hello, Dr. Jamal Harrison Bryant of the New Birth Missionary Baptist Church in Atlanta, Georgia, is my daughter, Stephanie Jameson's pastor. So she sent me a while ago one of his sermons that she thought was just so interesting and good and helpful to her. And in that sermon, I'm going to quote the wisdom he imparted. Proper preparation prevents poor performance. Do you have your pencils and do you have your paper? You might want to jot this down. Proper preparation prevents poor performance. 1. The oblivious zone operates by accident. Leaning on others' preparation. People do. Persons who take credit for your preparation, for your work. At least give an acknowledgement, as I am Dr. Bryant. 2. Overvalue people who put all of their confidence in what they have learned, not wanting to learn something new. Know anybody like that? 3. Optimum preparation are over-prepared and ready to perform here and now and ready for any new situation. My pastor is Dr. Shalita Fomby here in Maryland, Mount Calvary AME Church. And she recently preached about the here and now and ready for any new situation, people, as they are open to it. They are open to new experiences. So I gleaned this from her just this past Sunday. And I got it. I embraced it. Thank you, both pastors. 4, me. Overthinkers. People who are over-prepared. They are ready to perform and ready for whatever comes. They overthink the situation. Only overthinkers are over-prepared. They wake up with task front of mind. That's me. Yeah. So thank you to Dr. Jamal Harrison Bryant, and thank you to Dr. Shalita Fomby for enhancing our wisdom and giving us some additional wisdom we can use. So let's get started with class number 36 in the series. We've crossed over. This is exciting. The class, Medical, Emergency, and Healthcare Protocol. That's where we're going today. We will have discussed the planning and preparation to address various emergencies that may occur and how we might handle them. Some of my overthinking. Emergencies occur everywhere, it seems, and it's important that you and I learn and remember the steps to address as muscle memory. We discussed muscle memory in classes, I do believe 1 through 3 in our series. You might want to go back and take a look. We worked together to develop robust disaster plans to establish communication protocols before and after events. It's imperative to immediately activate emergency plans, the plans that we have built together since Class 1. Your in-house emergency team should respond rapidly to specific emergencies, providing basic life support. Efficiently using medical supplies and equipment with your staff is incredibly important. You are to stay calm and assess the situation, ensuring safety first, while providing basic support until the emergency medical team, EMT, providers arrive. Be sure to send someone to direct them to the scene, hopefully, while someone else is providing emergency care. This said, let's take a close look at what to do during an emergency. Rule 1, preserve life. As first responders or emergency team members, or any situation, your first priority should be to preserve life. You may need to perform CPR, stop bleeding, or take other actions to preserve the victim's life. Trained and certified staff are often responsible for handling medical emergencies. They're selected beforehand. We talked about that in our training. Sometimes you have nurses on the team. In our worship house, we have several nurses. We have a doctor, a medical doctor, and certain other professions are there to help. 1, call 911 immediately and follow up. Call to designated individuals listed on the emergency contact or call down list. You have this call down list beforehand, before an emergency. I taught you to. 2, identify your location. Where are you? Building name, on campus, and street address, and floor or specific area. 3, calmly describe the situation or emergency. Here's the how-to. What happened, or is it happening? For example, a heart attack or a fainting spell. The specific injury. Someone fell on ice. That's an injury. Help or type of assistance needed. An ambulance. Now, number 4, provide on-site first aid if you are qualified, and only if you are qualified. 5, designated and certified staff should be aware of and know the location of the first aid kit. The first aid kit could be called the star of this show and this presentation. 6, designated staff should maintain the supplies within the first aid kit. Medical staff and teams are pre-identified. When you have your emergency team meetings, that is part of your emergency plan. During an emergency, who do we call on for what? And who's qualified and what are their credentials? Just hearkening back to that specific training. You're going to have to get caught up if you're just joining us. If you want additional information, you just, hopefully you can thumb through and you'll find it, because we have several videos up. So, the clergy or designees who are responsible for verifying persons with medical certification are important to your team. Ensure these certified individuals are available and on duty at the time. You know, they may be off or on vacation, and someone else may be designated to be on watch or on call that day at your hospital, at your school, your elementary school, your facility, wherever you may be. 8, alert appropriate individuals who are responsible for any personnel who are pre-approved or have access to saved medical information and instructions. Example, medical alert bracelets. This person is wearing one or have one. They're diabetic, diabetes or cardiac history. And this information hopefully will be on file. The information might be available in personnel files, in the church office files, and at home. At home, I have a medical data condition packet. It lists allergies, medical insurance. Hopefully it's updated every 6 months. And it's called a File of Life card, and it's on my refrigerator at all times. And I looked at it before coming up to meet with you guys, and I have a new physician, a general practitioner. I've got to change that. So I'll take care of that this week. Thank you for reminding me, team. 10, only trained and certified personnel who are certified to administer first aid, CPR, cardiopulmonary resuscitation, should administer medical assistance. Note, issues of legal liability should be considered by leadership. 11, be sure someone on the security team is in the parking lot to direct the emergency responders to where your injured person is and what their needs are. Now, medical emergency advanced first aid bleeding control kits. Another star of the show. Yes, sir. Research shows that bystanders with the right tools, with little or no training, can save lives. Having medical staff trained in using the tools in a bleeding control kit can be the key to preventing tragedy or death in critical first minutes before help arrives. You are the help before the help arrives. I'm not double talking, because some people will be able to administer help. Some may not, but some may. And they're not necessarily the nurse or the doctor on the team. This will be worked out at the training table as you are updating your emergency training plan. Updating. What goes into the bleeding control kit? 1, tourniquets. Tourniquets. Primarily, this is one of the most critical pieces of life-saving equipment. The bleeding control kit is a tourniquet which stems arterial bleeding in a victim's extremities. Various designs are often and readily available. However, tourniquets that are appropriate and approved by the Army's Force of the United States for use in battlefield trauma care are highly recommended. 2, chest seals. This dressing is created specifically to treat one kind of wound, a sucking chest wound. These chest wounds are often from a gunshot, stabbing, or puncturing, and makes a new pathway for air to travel in and out of the chest, which can result in a collapsed lung. 3. Compression bandages. There are various ways to stop traumatic bleeding, and they all have one thing in common: compression. Compression bandages allow you to keep sustained pressure on a wound while freeing your hand to address other issues. 4. Bleeding control bandages. Deep wounds need to be packed with gauze to control the bleeding. When done correctly, it can significantly reduce the time. Direct pressure must be applied to arterial wounds. Some bandages also are treated with hemostatic agents that make these efforts more effective. 5. Space emergency blankets. Severe trauma can lead to shock and hypothermia. Shock happens when there is not enough blood circulating through the body to keep organs and tissues functioning normally. Hypothermia decreases a person's ability to form clots. Keeping warm delays the onset of shock and maintains the body's ability to clot. 6. Latex-free gloves. In situations that require a bleeding control kit, there will likely be other bodily fluids too. Nitrile exam gloves offer the wearer and the patient some protection from infection and blood-borne illnesses like HIV and hepatitis. Scissors. 7. During a traumatic high-stress event, getting to a wound in order to treat it might mean removing clothing. It is often safer and quicker to cut away the clothing than try to move the patient around. So you cut the clothing, don't move the patient. 8. Markers. A marker can be used to write on a variety of surfaces, including paper, tape, tourniquet flaps, compression bandages, and skin to record the time aid was rendered. This provides first responders with crucial information needed to render the best care. 9. Instruction documents. HB 496 specifically calls for instructional documents developed by the American College of Surgeons or by the U.S. Department of Homeland Security. They detail methods to prevent blood loss following a traumatic event. The instructions help readers prioritize which injuries to treat first and how. 10. NARCAN, nasal spray, competes with opioids to bind the same receptors in the brain, reversing the effects of an opioid overdose in 2 to 3 minutes. Carrying or having NARCAN nasal spray can make all the difference in an opioid emergency. Substance abuse and addiction hotline can be called 24/7, 24 hours a day in the U.S. The number, pencils up, 1-844-289-0879 in the United States. And you should have your information in your district or country available to you. So, that is our presentation of the day. in which I call news you can use. I thought about it, overthought it, researched it, and tried to think about at this level of your training and development, what might have I missed? What additional information you might need? So that is why we train this way today, a little different from last week. So think about it. Contact me at my email address, preparebeforeithappens@outlook.com, if you need to ask questions or you need me to address questions next week. And sometimes I go ahead and do that. I'll slip it in. And if you need to consult with me, you need a consultation, your team needs a consultation, you need a TED Talk, whatever you might need, I'll try to provide that. And if I cannot, I will be honest and let you know that may be above my pay grade, or I may not have the resources to do it. Whatever it may be, you email me, let me know. I'll try to do it. Also, on the YouTube channel, there's a place where you can ask questions to the presenter. That's available to you as well if you want to contact me. Until then, I'll see you next week with something new. And thank you for your support. Many of you are watching, but I need a like, and please do subscribe. It helps the channel. It helps the channel if you subscribe. I would appreciate it if you do so. This is Lauren Holley-Allen. See you next week.